Good morning, everybody, and it's my pleasure as UNDP Administrator to welcome everyone to the technical consultations of the International Ebola Recovery Conference. Allow me to begin by welcoming the Ministers of Finance of the three Ebola-affected countries who are on the podium with us. Minister Mohamed Diarra from Guinea, Minister Amara Kone from Liberia, and Minister Kaifala Mara from Sierra Leone. And I also welcome the Secretary-General of the Mano River Union, Madam Saran Daraba Kaba. Without the leadership and the steadfast commitment of the three governments represented here today and the Mano River Union, we would not even be in a position to be talking about recovery. Nevertheless, the recent new cases in Liberia and ongoing new cases in Sierra Leone and Guinea remind us that the battle against Ebola hasn't been won yet, and also underlines the urgent need to scale up national, regional and global capacity for public health surveillance and emergency management. While getting to zero and staying at zero will be central to the sustained Ebola response, national governments rightly want to step up the focus on recovery and development. Decisive action now, under national leadership with generous international support, will help address the devastating social and economic impacts of Ebola and support the three countries to get firmly back on their development track. The Recovery Conference, which is held tomorrow following these technical consultations, builds on meetings held earlier this year in Brussels and in Washington, D.C., as well as on events organised at ECOSOC and the Peace Building Commission. The briefings and discussions today are inputs into tomorrow's formal pledging conference. Then later this month, the African Union will be organising a conference in Malabo, Equatorial Guinea, on Africa helping Africans in the Ebola recovery and reconstruction. We're all very aware of the devastating impact of Ebola on the people, communities and institutions of Guinea, Liberia and Sierra Leone. This impact will be felt for decades to come unless we all step up our support. The most direct impact was the tragic loss of life. The epidemic also halted the rapid growth rates all three countries had been experiencing. There's been a slowdown across the national economies, from the agriculture sector, which accounts for a large share of GDP and livelihoods, through to construction, mining and the service sectors. Many people lost their jobs and their livelihoods. The economic slowdown and the urgent need to divert resources to the stop and treat phase of the Ebola response badly affected government budgets and development spending. The outbreak has had a disproportionate impact on women, both in the numbers infected and deceased, and on the ability of the health systems to deliver essential services, such as for pregnancy and childbirth. But health services were affected across the board. We understand, for example, that HIV screening went down by around 90% in Sierra Leone. The epidemic disrupted long-standing traditions of community support and caregiving. As a way of containing the spread of Ebola, families are urged not to treat their sick, and stigmatization has been widespread. Trust between peoples and within communities, the backbone of social cohesion, was undermined. To address the many challenges, each of the three countries and the Mano River Union have prepared the recovery strategies which are the basis for this conference. The strategies are complementary. The national strategies outline country-specific activities, while the Mano River Union plan focuses on sub-regional and cross-border issues. Together, the overarching objectives of the plans are to halt the epidemic and prevent future outbreaks, restore and strengthen capacity in public services, including health, restore livelihoods and build community and national resilience, and address structural factors which made containment of the disease difficult. I'm pleased that the UN and other partners have supported the development of the strategies, and we very much look forward to the detailed briefings from the Finance Ministers and the Secretary-General of the Mano River Union in this morning's session. These opening presentations will then be followed by 4 thematic sessions on health, nutrition and WASH, on governance, peace building and social cohesion, on education and social and child protection, and on socioeconomic revitalisation, all critical components of a comprehensive approach to recovery. These themes are featured in the Ebola Recovery Assessment and were identified by the 3 countries and the Mano River Union as important cross-cutting priorities. The focus of today's discussions will be on approaches to and principles for recovery, to get a better understanding of how the 3 countries are going about the recovery process and how various actors can contribute to it. These discussions will inform the high-level segment tomorrow. In closing, let me assure you that the UN as a whole and UNDP as the lead agency designated by the Secretary-General to support recovery are committed to helping countries turn their visions for recovery into reality. So, I wish you all very productive discussions today. I ask for generous support from partners tomorrow so that the foundations can truly be laid for sustained economic and social recovery from Ebola in Guinea, Liberia and Sierra Leone.